They really never figured out an exact reason why I got sick. Kind of just decided the bad stuff got out, the good stuff is in. I've had no problems since then, which I'm very lucky for.
There are 3 different types of intestine transplant. The first is the most straightforward, which is intestine only. This is for a patient who has lost function of their intestine, but all other organs are intact and functioning normally. A modified multivisceral transplant is where the entire gastrointestinal tract in the abdomen is dysfunctional. And so we actually have to replace the stomach, the duodenum, the small intestine, and the large intestine. So we replace the entire gastrointestinal tract. The thing that's interesting about a modified multivisceral is we also have to replace the pancreas, because the pancreas is intrinsic to all of the gastrointestinal tract, and if we try to remove it, it would actually cause more complications than just leaving it there. The third type of transplant is a multivisceral transplant. The multivisceral transplant is a modified multivisceral transplant, and we include the liver. So by the time that we've replaced all of that, we've basically replaced every organ in the abdomen except the kidneys and the bladder.
So I was a sophomore at Indiana University, started to experience very bad stomach aches. My appetite was going away. I was constantly tired. Things had really started to get bad. Of the weight loss started to kick in. 83 pounds was my lowest. I was not myself at all. They said, this is where transplant comes in. So we made an appointment here. I met my transplant coordinator, and we hit it off immediately. I met my surgeon. He walked in, just nothing but confidence, looked at my file and didn't really bat an eye. He kind of looked at my case of, oh, this is completely manageable, which no one had done before.
There are a limited number of centers in the United States that offer intestine or multivisceral transplant and do it routinely. So they come to us because we give them the option of being able to replace all the organs with new organs that are new and functional.
At this point, it was just survival mode. Nothing else really mattered. I knew what I wanted the end to be. Whatever the means to get to that end are, I was fine with it.
The process of obtaining an intestinal or multivisceral transplant is not that complex, but there are a large number of things that have to happen to make it all be successful. The patient, when they first are referred to us, we undergo a very meticulous review of all their medical records. We have a list of tests that have to be accomplished before the patient can be put on the list for intestinal or multivisceral transplant.
It was basically like a 3-day physical, head to toe. If there was something going on, they would have known it. Heart tests, psychology exams, complete body scans, anything you can think of, they knew it.
We'll then present all that information to a listing committee. It's a committee from various different subspecialties, and they review the entire case of the patient, including their medical history, but also their psychosocial evaluation, the insurance status, things of that nature, to make sure that everything is in place to make it successful. Once they have approval from the listing committee, then it's submitted to insurance, and once we have insurance approval, then we can put the patient actually on the transplant list. At Indiana University, our time to transplant is very short. It's one of the shortest in the United States. In general, we require that they be within 4 hours of our center so that they can get here in time to be evaluated. We have to have labs drawn. We have to look at them again and make sure that they're currently healthy to be able to undergo such a large operation. In the meantime, the team is sent out, assuming that the patient looks okay. They travel to the location of the donor. The organs are then taken out or procured, we say, and brought back if they look good.
But they have you sitting there waiting. So the second everything comes in, you are ready to go, they're ready to go, and everything can start.
The operation can last anywhere from 4 hours up to 12 or 14 hours, again, depending on the complexity of the transplant and the medical status of the patient. After that, the time in the hospital varies. I would say on average, for an intestine transplant alone, the average stay in the hospital is 2 to 3 weeks. More complex patients, such as multivisceral transplants, on average stay at least a month in the hospital.
My energy came back, my appetite came back. They said, we think you can go home. I kind of asked the question I've been waiting for, like, can I get back on a bike? They said, yes, go for it, start slow.
Thomas has been certainly one of our big success stories for sure, because not only did he return to a normal life, but he really pushed it and has returned to seeking his college education, to sports, to activity, to really testing his body and making it as healthy as he could.
I mean, my biggest concern was whether I'm going to be in the hospital that day to, do I have to wear a long sleeve jersey or a short sleeve jersey? Like, it just, everything came back to how it was before I got sick. So I really just dove back into the deep end, and it went great. I started putting in the miles, and I raced the little 500, had a blast with it.
Our main goal is, can we return the patient to the type of life that they want?
So those are all the guys I rode with. Probably still some of my best friends.
And in general, once you've had an intestinal multivisceral transplant, we follow you for the rest of your life. And so we know you, and we will always know you.
I won this whole fight. It's over. This was a chapter. I mean, I can mark the beginning, and I can definitely now mark the end.
Remember, if you have any questions about intestine transplant at IU Health, you can contact any of the members of our team. Our overall goal is to return you to wellness and improve your quality of life. Thank you for choosing Indiana University Health for your healthcare needs.